Last month, lawmakers in Olympia released a new report showing overdose deaths in Washington jumped 21% from 2022 to 23. Now, KREM 2 is looking into your questions about recent reports that drug overdoses are also spiking here in Spokane. KREM 2 Shannon Mowdy is getting answers tonight. Shannon?
Viewers have reached out to us after seeing reports overdose after overdose in Spokane. I found out the true scope of the problem may be hard to calculate. It's hard to know the true toll of the drug problem in Spokane, but Lieutenant Terry Prinninger says the trend so far this year is troubling.
Just over 30 mentions of the word Narcan in police reports in cuts covering about a 9-day period.
That's through his checking police reports for words like Narcan or calls for police response that later turned out to be overdoses.
It does seem to be that there is a little bit of an increase just in the last few weeks.
For Spokane police, tracking overdoses is difficult. It isn't a crime, so they're not always logged. Other times, citizens are the ones administering Narcan, so there's no police report. Far more often, overdoses require an EMS response. So I reached out to the Spokane Fire Department. An information officer says data shows a consistent and significant rise in OD calls since 2022. That year, SFD responded to nearly 1,200 overdose calls, an average of 3 a day. Last year, that number ticked up to 1,600 overdose calls, averaging 4 a day. In the first 38 days of 2024 alone, SFD has responded to 249 overdoses, an average of 6 every day. Actual overdoses are likely higher since some come in as cardiac arrest calls.
It is very difficult to track.
One issue is the lack of a centralized source for tracking overdoses between police, fire, the medical examiner, and hospitals.
There is not, that I know of, any kind of repository where all 4 of those groups are placing that information into a single space.
Another unknown right now, what's causing the apparent rise. Lieutenant Prinninger says it's too early to know if it can be linked to a single drug or a new version of Spokane's current problem substance.
Fentanyl is the #1 problem we have. It is bar none, is outweighing all the other substances combined.
Spokane-County Regional Health's online dashboard shows the most recent numbers from 2022. There were 215 overdose deaths, with 73% attributed to opioids. And tonight we're still waiting on data from the county medical examiner and Spokane County Regional Health District, including how many fatal overdoses there are so far this year. Shannon Mowdy, KREM 2 News.